Okay, right. So according to Schellenberg, there are five. That is preservation of tooth structure, retention, resistance form, structural durability, marginal integrity, and preservation of the periodontium. And according to Rosenstiel, there are basically three types. One is biological concepts, mechanical concepts, and aesthetic concepts. Okay. So the next one is coming to the tapers. Okay. So normal range, if they're asking. So normal range, if they're asking, your answer should be 2 to 5 degrees. Clinical range is 10 to 16 degrees. Clinical range is 10 to 16 degrees. And coming to optimum degree of tapers, for an anterior teeth, it will be 10 degrees. Let it be maxillary or mandible. For a posterior teeth, it ranges from 12 to 22 degrees. 12 degrees are regularly used in the premolars. 12 degrees are regularly used in the premolars. So can you tell me what is the concept of taper related to retention? How the tapers are going to relate to retention? So the curve of taper and retention, okay, so will be like this. Okay, so it will be like this. Means as, okay, so yes, regularly a 0 degrees taper is going to have the more retention. Okay, so when the taper is 0, which is clinically not possible, so this is going to have perfect retention. As the taper value increases, retention is going to decrease. And at a particular level, it is going to become constant. Okay, so can you tell me the decreasing order of value, that is from lightest to darkest? Very frequently repeated INI-CET question. Yes, it starts with B1.
B1, A1.
So B1 followed by A1, followed by B2, followed by D2, followed by A2, followed by C1, C2, D4, A3, D3, B3, A3.5, B4, C3, A4, and what is the last one?
C4.
Last one is C4. The sequence is very important. So this is from lightest to darkest value. Okay. And the next one is, yes, coming to rule of three, which is basically used in your ortho. Okay. So can you tell me the landmarks? The hairline landmark is? The hairline landmark is? It is tricon. So the landmarks will be tricon. The second one is glabella. And the nasal is subnasal. And the lower one is menton. Okay, right? So these are the landmarks which are important. So it is, first one is from this to this. Second one is glabella to nasal. Third one is nasal to menton. Okay, the next one is one more case-based question. By seeing this collage, can you identify the case? You can see multiple, yes, of course, the answer is actinomycosis. Very good. So the most common area, can you tell me the most common area of occurrence of actinomycosis? Faciocervical. That is angle of mandible. You can see here in this diagram, you can see angle of mandible, where you can see multiple sinus openings. You can see multiple sinus openings. And if you check out the sinus opening, the sinus opening is having some yellow granules. What are these yellow granules?
Sulfur granules.
So these yellow granules are sulfur granules. And what is this histological feature you can see here?
Sunburst appearance. Sunray.
You can see sun ray appearance. And how will be the colonies in actinomycosis? Yes, one type of colonies in actinomycosis. Yes, perfectly right. They are molar-like colonies. Can you tell me what are the other types of colonies? Yes, very good. One is molar-like colonies you can see. Second one is spider-like colonies. Can you tell me what is the drug of choice? Drug of choice. Yes, drug of choice is penicillins. Can you tell me what is drug of choice for ANAG? ANAG drug of choice. Yes, ANAG drug of choice is again penicillins. Okay, penicillins is the better drug, followed by metro, followed by metronidazole. Penicillins followed by metronidazole. Syphilis, what is the drug of choice? Yes, syphilis, again, the answer is penicillins. So drug of choice based questions are very, very important. Okay. So syphilis is penicillins. Drug of choice based questions are very, very important. Make sure you try to be clear with the drug of choice. Of course, Risa, you're right. It is 2.4 million units regularly we give the penicillin for a treatment of syphilis. Okay. Now, can you tell me what is the diagnosis of this intraoral ulcer? So what is this ulcer? What is the diagnosis? Which stage it comes under? Yes, here the diagnosis is snail tract ulcer. Okay. Yes, the diagnosis is syphilis. And which stage of syphilis you see this? Yes, you see in secondary syphilis. Can you tell me which stage of syphilis is more infectious? Infections will be the chances of infections will be yes. Which stage is more infectious is you can see more load of syphilis causing organisms in secondary syphilis. The same. Okay. Very good. Can you identify me what are these instruments? 5 in number. So what are these instruments? No. You see the tips here. You're not able to see them on my screen. The curates will be like this. Yes, these are PKTs. Yes, PKT will have two carvers also. Yes, these are PKTs. So what is the full form of PKT? What is the full form of PKT is? It is Peter K. Thomas. It is Peter K. Thomas. So PKT are instruments are basically 5. So the 1 and 2 instruments are basically useful for adding of wax. So 1 is useful for larger increments of adding, 2 is useful for smaller increments of adding, and 3 number is useful for burnishing, and 4, 5 are basically useful for carvers. Okay, so these are PKT instruments. Peter K. Thomas. You have 5 instruments. 1 and 2 are useful for wax addition, out of which 1 is larger increment, 2 is smaller increment, 3 is useful for burnishing, and 4 and 5 are useful for carving. So specifically, if they're asking which instruments are basically used for addition of wax, your answer should be 1, 2, 7. 1, 2 we have already discussed. 1, 2 are PKTs. PKT1, PKT2 are wax adding. The seventh one, number 7 is a spatula. So number 7 spatula, 1 for larger increments and 2 for smaller increments. So these are basically instruments which are useful for addition of wax. Clear? Done? Sure, I'm going to the next part. So next part is the concept of biological width. So biological width is a sum of junctional epithelium. Is a sum of junctional epithelium plus connective tissue attachments. That is 0.97 plus 1.07 together. Biological width around a natural teeth. Biological width around a natural teeth is going to be 2.04 millimeters. Okay, anyway, so we got the concept of biological width. Okay, similarly, I want to ask you a few questions. Can you tell me what is the biological width or normal range of probing depth around the implant? Teeth is 2.40. So I'm asking implant biological width. Yes, implant biological width, the answer is 4 to 4.5 millimeters. Same question was given in Neet 2023 also. So biological width around the implant is 4 to 4.5 millimeters, whereas biological width around the natural dentition is 2.04 millimeters. Can you tell me what is the critical probing depth value? Critical probing depth. Yes, critical probing depth is 5.4 mm. Similarly, can you tell me what is the critical pH of enamel? Below which demineralization takes place, above which remineralization takes place? 5.2 to 5.5. Can you tell me what is histological probing depth? Histological probing depth value. Yes, histological probing depth value is 1.8 millimeters. Can you tell me normal probing depth value? Normal probing value. Normal probing value is 2 to 3 millimeters. Okay. So normal probing value is 2 to 3 millimeters. Histological probing value is 1.8 millimeters. Biological width around the natural dentition is 2.04 millimeters. And biological width around the implant or probing depth around the implant is 4 to 4.5 millimeters. Critical probing depth value is 5.4 millimeters. And critical pH is going to be 5.2 to 5.5 millimeters. Clear? Done? I'm moving to the next aspect. Okay, so DM related stuff. I hope like you're familiar. They can ask you a sequence based question, a very important sequence of reactions that takes place in the calcination process of your gypsum. Okay, so gypsum is basically, you can see your gypsum is available. This is calcium sulfite hemihydrate. Okay, so it is hemihydrate. So whenever you heat this calcium sulfate hemihydrate at a temperature, this temperature value is very, very important. That is 110 to 130 degrees centigrade. So this is going to, yes, the dihydrate, it is going to convert into hemihydrate. Okay, so the water will be lost. Few molecules of water will be lost. Here you are going to have 2 H2O. Now it's going to be a half H2O. So a dihydrate is going to convert into hemihydrate whenever you heat to a pH, to a temperature of 110 degrees to 130 degrees. Followed by when you're overheating it, increasing the temperature from 130 to 200 degrees centigrade. Okay, now complete water will be lost, and that leads to formation of hexagonal anhydrate. And whenever you increase the temperature from 200 degrees centigrade to 1000 degrees centigrade, you change in the crystalline form. That is your orthorhombic anhydride will be formed. The sequence of events are important, and the sequence of temperature changes are important. What are the sequence of events? First, dihydrate is there, converted into hemihydrate, converted into hexagonal anhydride, converted into orthorhombic anhydride. If you're talking about the temperatures, first it starts with 110 to 130 degrees centigrade. Next one, 130 to 200 degrees centigrade. The next one, 200 degrees centigrade to 1000 degrees centigrade. Clear? Done. Okay, very important, must do. The next one, I'll be going with the concepts of C factor. A little bit of controversy there. I'll be discussing about the controversy also. First and foremost thing about the C factor, I want you guys to tell me the formula of C factor. C factor. So what is the formula of C factor? It is number of bonded surfaces by number of unbonded surfaces. Now, what is the use of C factor? Now, everyone knows the formula. So tell me, what is the use of C factor? Yes, C factor is going to talk about polymerization shrinkage. C factor is directly proportional to polymerization shrinkage. Okay, because one of the most important disadvantages of your composites is the characteristic feature of polymerization shrinkage, which lead to a clinical symptom in the patient leading to sensitivity or something. Okay, so as C factor increases, the polymerization shrinkage is going to increase. So it is basically because C factor is directly proportional to bonded surfaces. So as bonded surfaces increases, bonded surface increases, the C factor increase, which indirectly increases the polymerization shrinkage. So C factor is directly proportional to polymerization shrinkage. So we need to try to decrease our C factor. So the polymerization shrinkage is going to decrease. Okay, there are different methods. Okay, incremental method, different methods are there to decrease this polymerization shrinkage by decreasing the C factor. So now my main concern is about the exam. Okay, so whenever they're asking C factors of a particular teeth or something, okay, so simply, okay, C factor is bonded by unbonded. As you know how the cavity preparations will be, so you know what are the number of bonded areas, what are the number of unbonded areas, and you can come out with the exact value of C factor. Okay, no need to worry. Or else simple ways: class 1, class 2, class 3, class 4, class 5. Okay, simple: 5, 4, 3, 2, 1. Coming back: 5, 4, 3, 2, 1. Okay, out of which this is wrong. So these are the C factors that you have to make it. Sometimes basing upon the bonding concept and basing upon the cavity configuration, C factors will be slightly different for class 4, but rest all C factors will be same. For example, what is the C factor for class 1? So C factor for class 1 and class 5 will be same. Okay, that is 5 by 1. C factor for class 2. C factor for class 2. 4 by 2, the answer is 2. C factor for class 3. 3 by 3, 1. C factor for class 4 vary basing upon the bonding configuration or bonding concept or basing upon the cavity preparation, but it ranges from 0.5 to 0.25, around this value. Okay, clear, done. Now I just want to ask one more important question for you. Okay, so right, so this is one more table from a standard reference. They can ask you C factor for MOD. So MOD is something like a cavity like this, right? MOD is something like a cavity like this. So how MOD they're going to take is, so buccal side, they're going to take it as 1. Okay. Lingual side, they're going to take it as 2. Okay. And occlusal side. Okay. So buccal, lingual, and pulpal side. So the bonded number of bonded zones are buccal plus lingual plus pulpal. Whereas number of unbonded are occlusal, mesial, and distal. So it is 3 by 3. The answer is 1. Clear? And I want you to add one more important point about C factor. C factor is going to be highest for. So in classes, it will be highest for class 1 or class 5. But normally, this is going to be highest for root canal filling. Because root canal filling is going to have only bonded surface, not unbonded surface. So few textbooks are clearly mentioning that the C factor is going to highest for the root canal filling material. Okay, because the bonding concepts also came into root canal system. Okay, so C factor is going to be highest for root canal filling material, and it is around like 1000. Clear? So point number 1, C factor is equal to number of bonded surfaces by number of unbonded surfaces. C factor is directly proportional to polymerization shrinkage. Okay. So the number of bonded surfaces increases, C factor increases, by which the polymerization shrinkage increases. So our goal is to decrease the C factor. Coming to values of C factor, this is how you need to calculate. The most important thing is C factor value is highest for class 1 and class 5. If not, it is highest for root canal system, that is about 1000. C factor for MOD is going to be 3 by 3. The answer is 1. Done. I'm moving to the next one. Okay, most of you are familiar with this, the first year stuff. Okay, so this is about the impression, objectives of impression. So what is the abbreviation that we have learned about the objectives of impression making? Yes, it is PRESS. P for preservation, R for retention, E for aesthetics, S for stability, and S for support. Press. Okay, the next one, like most of us are familiar about this. So because we are going to use heat cure in the Prosto department, as well as you are going to use cold cure. So which is more advantage and which is more comfortable? Like regularly, we always prefer self-cure, that is more comfortable, right? But why you have to go for heat cure is, so when you're talking about the residual monomer concentration, which is going to cause shrinkage in the future. Okay, so the residual monomer is going to be less in the heat cure. So by which the shrinkage will be decreased, whereas the residual monomer percentage will be more in the self-cure, where the shrinkage will be more. So they can ask you how much residual monomer will be there in the heat cure and self-cure. So the residual monomer values in the heat cure will be 0.2 to 0.5%, whereas in the self-cure it will be 3 to 5%. Okay, next one, definition of flux. So most of us are familiar. So flux is a Latin word. It is basically to flow, to improve the flow. Okay. So normally, whenever you take this metals, all these areas, so metals are going to react with oxygen in the atmosphere and they form oxide layer. Okay. Basically, these oxide layers are very passive. They don't react. They don't allow it to react. Okay. So whenever you want to react it, okay, so you have to remove these oxide layers. To improve the flow, what you have to do, you have to remove this oxide coating that is present on the metal surface. Okay. The process by which you remove this is called as applying a flux to improve the flow. See here, I want you to make a note. So the byproduct which is going to form after applying flux, that is resultant, you have a solution of oxide layer. Okay, that is called as slag. They can ask you, what is slag? Slag is the byproduct, which is basically the solution of oxides that are formed. This is slag. Clear. Now I'll be talking about the types of fluxes. So fluxes are basically divided into one, protector flux, second one is reducer flux, third one is solvent flux. What is protector? Protector is basically, protector, you can easily remember protector with the word P. Protect prevents P and P. Okay. So it covers the metal surface and prevents the oxide layer formation. P for P, that is prevention. Next one, reducer, R. So reducer is reducing the oxide layer formation. S for S. Okay. Solvent flux is dissolving the oxide layer that is being formed. Okay, right? So there are three types. Protector is preventing the oxide layer formation. Reducer is reducing the oxide layer formation. Solvent is dissolving the oxide layer formation. Next one, if you jump into different types of fluxes basing upon their composition, fluxes are basically divided into borax fluxes and fluoride fluxes, in which the borax is going to have boric acid, silica, and borax glass. Whereas fluxes are again divided basing upon the pH of the flux that is being used. You know that the pH is basically, let it be acidic pH or let it be basic pH, let it be neutral pH. So acidic fluxes are SiO2, basic fluxes are either lime or limestone, that is CaO or CaCO3. Whereas neutral fluxes are basically either you can use fluorspar, that is CaF2, or borax fluxes, that is Na2BO4O2. Okay, so they can ask you what is acidic flux, what is basic flux, what is neutral flux. So the next one, when I'm talking about according to the source, basing upon the source, your fluxes are being divided into organic fluxes or inorganic fluxes. So organic fluxes are basically used in soft soldering procedures, which requires low temperatures. So these are soft, organic are soft, and low temperature. The next one is inorganic fluxes. Okay, so these are basically acid-based fluxes. They are used in brazing, okay, which requires higher temperature. Okay, so brazing which requires higher. So inorganic requires higher temperature. Can you tell me what is the difference between soldering and brazing? Soldering and brazing. Can you tell me what is the difference between these two terms? Yeah. How I simply remember is B. B for big. B for big. B for big. So soldering is basically less than 450 degrees centigrade, whereas brazing will be more than 450 degrees centigrade. Okay. So basically in soldering, you are going to use organic fluxes, whereas in the case of brazing, you are going to use inorganic fluxes. Okay, done. Next one, basing upon their composition, here it is very important. You have borax fluxes and you have fluoride fluxes. Okay, the most important thing is what is the type of flux that is used whenever you're going for noble metals. So noble metals, what is the type of flux? So noble metals, you're going to use borax fluxes, whereas base metals, you're going to use fluoride fluxes. Very, very important. FB, you can remember it as FB. F and B. F for fluoride fluxes, B for base metal alloys. FP. Clear? Done? Can I move to the next part? Okay. So the next one is anti-fluxes. So anti-fluxes, flux is going to allow the flow. So now anti-flux is going to restrict the flow. Anti-flux is going to restrict the flow. Okay. So the two important anti-fluxes we have is one is graphite. So graphite is basically lead pencil. Okay. That is going to contain carbon. The disadvantage is whenever you prolongly heat at a higher temperature, this will burn off and give discoloration. So there is something, one more flux, anti-flux, that is called as whitening agent, which is CaCO3 in alcohol and water suspension. So you have two. One is graphite and second one is CaCO3 in alcohol. Okay. clear, I'm going to one more important concept where the questions are very frequently repeated. So I'll be talking about electroplating now. Okay. So before jumping into electroplating, can you tell me what are the elastomeric impressions which can be electroplated? Which of the elastomeric impression can be electroplated? Yes, perfectly right. The answer is polysulfide. So polysulfide impression material can be electroplated. One. Okay. So electroplating is going to have one important aspect is it's going to have a solution. It's going to have an anode. It's going to have a cathode. Okay. Can you tell me what is the solution? Name of the solution. Name of the solution in electroplate. What is the name of the solution? Yes, the name of the solution is silver cyanide. Very good. The name of the solution is silver cyanide. Can you tell me what is anode? What is anode? Because this question was repeated twice in the last 5 years. Yes, anode is silver. Can you tell me what is cathode? I told you, easy to remember. How your impression tray will be. This is your impression tray. Impression tray will be C-shaped. So impression tray will be, your impression will be cathode. Your anode is silver and the solution is silver cyanide. Right. Clear, right? All the 4 points. Which elastomeric impression can be electroplated? The answer is polysulfide. What is the solution that is used? Silver cyanide. What is anode? Silver. What is cathode? Impression material. Okay, now few terms I want to add. One is depth chamber gas. Okay, sometimes what can happen is because the silver cyanide is present, sometimes there may be release of cyanide vapors. Because of the release of cyanide vapors, this area or this chamber is called as depth chamber. Okay, and as you know, where the deposition should occur, cathode or anode? Yes, you can see because cathode is an impression material, something should come and fall under cathode. Then only electroplating will occur. So cathode deposition should occur. And so deposition will start from anode. Okay, it starts from anode. Okay, that is silver, and the deposition will occur on cathode. Okay, so this process is called as throwing powder. This process is called as throwing powder. They can ask you where the deposition will occur. The deposition is going to occur on the cathode, that is impression. Now, the other important point that I want to highlight here is the last lines. Okay. So how much time it has to be carried out? Electroplating is carried out for approximately 10 hours. Electroplating will be carried out for 10 hours. And the current that is used is 5 to 10 milliamperes per centimeter square of cathode surface. And one more important point I want you to make a notice, an anode of pure silver is anode, right? At least twice the size of the area to be electroplated. So how much amount of silver you have to give is, it should be twice the area that you are planning to electroplate on the impression material. Such amount of silver has to be provided at anode so that it will be deposited upon the cathode. How much time? 10 hours. How much current? 5 to 10 milliamperes per centimeter square of cathode surface. Okay, right, clear? Here concept where what is anode, what is cathode, which materials are basically used, that is your polysulfide, and where the deposition will occur were the questions which are given in the last few years. Okay, the answer is cathode, where the deposition is going to occur. Okay, next one, a few, one or two important lines about your dye material. Okay. Can you make dye with amalgam? Yes or no? Not now. I mean, like not used nowadays, but I'm asking, yes, amalgam can also be used as a dye material. Okay. So the most stable dye materials are, most accurate and stable dye materials are Most accurate and stable dye materials, sir. What are most accurate and stable dye materials? What are most accurate and stable dye materials? Yes. And 4 and 5 types of your fourth and fifth type of your gypsum material. 4 and 5 type of your gypsum material or your dye stone is going to be the most accurate and the most stable. Okay. So now I just want to add one important point related to epoxy resins. Okay, epoxy resins, but the main disadvantage of this 4 and 5 gypsum materials is their abrasive resistance is very, very poor. Okay. So when I'm talking about epoxy resins, epoxy resins has more abrasive resistance. Okay. But the main problem is they are less accurate and less stable. Okay. I want you to make a note. So they can be used safely with elastomeric compression materials like polysulfide by using a separating media and addition silicone and polyether. So epoxy resins can be used with polysulfide, addition silicone and polyether. Okay, so these are more, they have more abrasive resistance, but more accurate are your type 4 and type 5 gypsum products. Okay, so jumping into the centering temperature classification, 2 times repeated in the last 5 years of your Neet examinations. Of course, it's repeated so many times in INI CET also. So it is a mandatory that you have to make a note and you have to keep them in the checklist and revise them again and again. Okay. The first and foremost important thing is temperatures. Okay. So temperatures they can ask in centigrade or temperatures they can ask in Fahrenheit. Okay. Right. So high fusion is more than 1300 degrees centigrade or more than 2372 degrees Fahrenheit. And ultra low fusion will be less than 850 or less than 1562 degrees Fahrenheit. Okay. So similarly, they can ask you medium fusion. They can ask you low fusion also. So sometimes they can ask you at what temperature, at what sintering temperature regularly we use zirconium core ceramics. Okay. The answer is high fusion. Okay. So they can ask you the application part also. Okay. Normally crown and bridge ceramics will be done at either low fusion or ultra low fusion temperatures. Okay. So very, very important. So please do make a note and add this to your checklist during your last round of revision. Next, definition of laminates. Laminate veneer definition. So a conservative aesthetic restoration of anterior teeth that is basically used to mask the discoloration, restore the mal-aligned teeth, close the midline diastema, and correct the minor tooth malalignment. Okay, so this is from Mossbase dictionary. Okay, so very, very important. So nowadays they're asking these such a questions in the examination. So laminate veneer, what is the definition? A conservative aesthetic preparation which is masking the discoloration, restoring the malaligned teeth, minor tooth corrections can be done, and closing the midline diastema. Okay. Now tell me, what are the restorative materials? Which combination of restorative materials are used in sandwich technique? Which restorative materials are basically used in sandwich techniques? So in sandwich technique, basically we are using, yes, you guys are right. We are using GIC in combination with composite. So sandwich technique is basically of 2 types. One is open sandwich and second one is closed sandwich. Open sandwich, where the GIC is exposed outside. You can see this orange color is outside. It is exposed to the oral cavity. So open is open to the oral cavity. GIC is open to the oral cavity. Closed is GIC is not open to the oral cavity. You can see here the GIC is being covered from all the directions by the composite. Okay. So that is the difference between open sandwich and closed sandwich.